a WJZ special, Baltimore Standing Together, searching for solutions to the opioid epidemic. Now, here's WJZ's Vic Carter and Denise Koch.
Hello, everyone, and welcome to Baltimore Standing Together. This is the second in a series of town halls presented by WJZ, the Baltimore Sun, and the University of Baltimore Schaefer Center of Public Policy. The next hour, we will be looking for ways to address the opioid epidemic. Addiction and overdoses are happening on an epic scale. Thousands of families torn apart. Most of us know what the problems are, but finding the solutions is the real challenge. We're so honored to have with us here today. Joining us right now for today's town hall, we have with us Dr. Lena Nguyen. She is the Baltimore City Health Commissioner. Thank you for joining us. Harford County Sheriff Jeffrey Gaylor, whose county has been hit particularly hard by the opioid epidemic. Pastor Craig McLaughlin of the Mount Zion United Methodist Church, and Edgar Wiggins of the group Baltimore Crisis Response. Joining us in the audience now, my co-anchor, Denise Koch.
Thank you, Vic. Well, as we look for solutions to the state's and the nation's #1 social crisis, we have gathered together with us today in the audience health professionals, legal experts, law enforcement, most importantly, individuals and families who have faced the opioid epidemic and taken it to heart. We also have people here with us today who are dedicating their lives to helping those who are suffering from the disease of addiction. We sent a team of reporters out to investigate this issue, and what we learned is that drugs that can be a vital service when you are in pain can also be horribly addictive and can lead to a downward spiral that will take with it families and entire communities. So hopefully over the next hour we together will tackle this problem and find some solutions so that we can move ahead and do something to this crippling crisis that's taken over our state.
Denise, thank you. So how did we get here? WJZ investigator Mike Elgren shows us how widespread this problem is and how difficult it is to understand.
My son's name?
The opioid epidemic is ravaging America, from powerful addictive painkillers to heroin, claiming 175 lives nationwide each day.
The pandemic is devastating the very fiber of this country.
Maryland is one of the top 5 states for opioid overdose deaths, a staggering toll. 1,500 people died in just the first 6 months of last year.
We see about 1,000 people a day who need treatment, and it's far less than what the actual need is.
Can you hear me? 5
people a day are dying from opioid overdose. That's shocking. If that was any other disease, it would be, on everybody's lips.
Any corner you go to, you can get the heroin. People, are overdosing left and right, like it's no big deal.
While heroin is a major problem, powerful synthetic opioids like fentanyl and carfentanil are leading to a surge in deaths. You can see just how little of each substance it takes to kill.
The size of a grain of salt would be enough to cause an overdose and take your life.
In hard-hit Harford County, a deputy even became ill after being exposed to fentanyl on the job.
I started sweating profusely. My face started burning.
Put your hands up now! As part of Harford's war on opioids, an elite task force is targeting the supply chain.
This is a packet with gel caps.
Track it down to the dealers.
It was a crisis.
The governor has declared a state of emergency. Some counties have even sued manufacturers of addictive opioid painkillers. Anne Arundel County, which has also been hit hard with the 3rd highest number of deaths in the state, launched the Safe Stations program, where anyone with an addiction problem can go to any fire station and get help.
Welcome back, brother.
In Baltimore City, health officials have made Narcan, which can revive those who've overdosed, widely accessible, and partnered with hospitals to help addicts.
Addiction has to be treated like a disease. No hospital would ever say we don't treat patients with cancer.
The crisis has not peaked yet, and the cost in lives is so high, leaders can't afford to stop fighting.
So, seeing that reminds us just how bad this problem is. We're going to ask our panel here today to answer these questions. Where do we go from here? What are the solutions? Dr. Nguyen.
We have to first recognize that treating addiction as a crime is just inhumane and unscientific and not effective. So here in Baltimore City, we focus first and foremost on saving lives. if someone is dying right now, we have to save their life in order for there to be a better tomorrow. And so we've made naloxone, or Narcan, which is the opioid antidote, widely available. I issued a standing order, which is a blanket prescription for naloxone, to every single one of our 620,000 residents in Baltimore. And in the last 2 years, everyday residents have saved nearly 2,000 lives. And we're partnering with so many others in our state, in the city, including our fire department, so that we can target these hot spots of where fentanyl is, and then we can connect people directly into treatment.
Sheriff Kaler.
I certainly agree that we're facing something that we have never seen. We've seen previous opioid epidemics in our country's history. And in Harford County, we've taken a unique approach in that we're still going to do our law enforcement job. We're responsible for law enforcement corrections, and we aggressively target the dealers. But we're also working with so many community members, our county government, our county executive, and just true members of the community to say what else can we do. And a lot of the kind of out-of-the-box thinking, Narcan, again, throughout our community, throughout our office, throughout the detention system, inmates as they get released, Vivitrol at the jail. So many different concepts as our awareness effort goes forward. That's not your traditional public safety approach. Is the way we're also combating it, in addition to still doing our law enforcement and targeting the dealers, because those are the people that are costing so many lives.
Okay, thank you. Of course, this is a very personal thing for you. Pastor McLaughlin, tell us your story.
4 years ago, my daughter Hannah, 19 years old, died of a fentanyl overdose. She had been a heroin addict for 4 to 5 years before that. My passion, we know what makes persons vulnerable to addiction: trauma, anxiety disorder, ADHD. What do those vulnerabilities look like while the child is still 8, 9, 10 years old? There was a raging sea under the calm surface of our daughter. I didn't even know it.
Wow.
But we can learn what it looks like when they're young. Okay. That's my passion.
I'm sure. Mr. Wiggins.
Well, Standing Together, I think, is the perfect title for this meeting, because from where I sit, it's not just about behavioral health organizations like mine. I mean, we provide crisis services to people with behavioral health conditions. But what has really become important as we move forward are collaborative efforts with, for instance, the Baltimore Police Department. We have a program called LEAD, Law Enforcement Assisted Diversion, where the police identify and try to divert people who are found being engaged in low-level drug crimes to get them involved in treatment. Our crisis response team program, which teams a specially trained clinician with specially trained police officers who respond to behavioral health calls for service. You know, our work with the faith community. So this panel is an excellent example of what we need to combat this terrible problem.
Well, so many issues to address here. Denise?
Well, thank you, Vic. I'm here with Clay Stamp, who is the executive director of the Opioid Operational Command Center, which is a statewide agency, my understanding is, and it's new. It's only about a year old. And you are trying to see statewide how this problem is impacting.
Yes, Denise. As you know, the governor declared a state of emergency because truly we do have a crisis that's affecting families and separating communities all over our state and, frankly, our nation. This is probably the worst crisis that many of us have ever witnessed, like we would with any other crisis, to facilitate communications, to drive programs in a balanced effort in the areas of prevention, enforcement, and expanding access to treatment and recovery services, because it takes all three. And at the end of the day, it's going to be a comprehensive prevention program to change our culture to remove the demand away from the supply that is hitting our streets today.
So we have people from all different avenues, so they contact you if they want to find out information?
So the state's role is to empower local jurisdictions to do what they do best, and that is make a difference in their community. The other thing we're doing is creating a sharing platform. So best practices, for example, the Baltimore LEAD program, the Law Enforcement Assisted Diversion program, we're spreading that to other jurisdictions. We're spreading, sharing best practices, if you will. So it's an all-hands-on-deck approach. We're all in it, and the people you see in this room, they're all a part of an army of people that care. And it's going to take an army of people to do the hard work, to put our nose to the grindstone, to continue to do the hard work in this crisis, because every life matters, and it's about saving lives.
All right. Good phrase. I like that phrase. Thank you, Clay.
Thank you. Thank you, Denise. Well, while the opioid epidemic is worse than ever before, law enforcement officers are on the front lines doing everything they can to keep narcotics off the streets of Baltimore and around the state of Maryland. Rick Ritter sits down with the DEA and tells us how agents are combating the crisis here in Charm City.
In the streets of Charm City, the opioid epidemic has a grip like never before.
This is the transshipment point, Baltimore.
On the front lines of this battle, the DEA.
There's a great effort going on in Baltimore to change the culture.
Special Agent in Charge Carl Coulter, who's been on the job for 32 years.
If you laid Maryland, for example, on a table, and you look at all the highways, it's like an artery.
That artery starts with Charm City, but many consider the epicenter of the problem with drugs making their way in from Mexico.
As far away as the Shenandoah Valley in Virginia, you have people coming into Baltimore to purchase heroin.
Coulter calls it a different age because of the synthetics, especially fentanyl, which can now be bought online and is far more cheaper than heroin.
50 to 100 times more potent than heroin itself.
Coulter says the DEA is working hand in hand with law enforcement and agencies across the state, leaving no stone unturned.
All it takes is one piece of information and agencies sharing information.
Capturing data, building investigations, and targeting major distributors on the streets. It's what led to this recent seizure of fentanyl in Baltimore.
33 kilograms of fentanyl, which could have killed everybody in the state.
Also following the paper trail of pain clinics, a recent raid in Towson of a center that had 4,000 patients, along with a national take-back day that collected 12,000 pounds of prescription drugs. But with drugs comes violence. Gangs in Baltimore are dealing the lethal doses, fighting over clients.
Different cliques, crews, gangs, rival gangs fighting against each other for territory.
With the DEA focused on education, treatment, and prevention, there's hope that a turnaround is within reach.
We are lucky enough to have with us today some representatives from the DEA. We do appreciate you coming and joining us today, and thank you for the work you do as well. And I'm also now with Deputy Fire Chief Mark Fletcher in Baltimore City. And your people are in the trenches every day. You get called to these scenes. What can you tell us? What do you see?
Well, what we're seeing is actually an increase in the amount of fentanyl on the street, as we just witnessed, and it's actually evidence-based and leading towards an increase in fatalities associated with heroin and the fentanyl.
Do you feel in danger because of the drugs you have to come in contact with?
We have policies and procedures in place for us to be able to safely deal with potential carfentanil or fentanyl exposure for our personnel. But, you know, we're ready to handle it. We were well prepared to respond to the public.
While fighting the opioid epidemic day and night, an elite Hartford County task force is gaining international recognition for its progressive approach to helping addicts while gaining the intel it needs to take down the dealers. WJZ was given rare access to the front lines of this fight.
Put your hands up there!
Dramatic moments on Baltimore City streets. WJZ cameras on the front lines with Hartford County's elite opioid task force as they move in on a suspected drug dealer.
Out of the car! Out of the car! Out of the car! Go down.
Once in custody, officers search the suspect's house.
Please search warrant! Got you. Please search warrant! Police, search warrant!
This squad is made up of the best. Officers with specialized training and full federal authority to cross city, county, and state lines to go wherever they need to get some of the most dangerous criminals off the streets.
Our main objective is to do what we did tonight, is to track it down to the dealers that are providing the heroin and fentanyl to our citizens up in Hartford County, especially the ones that have lost their lives.
Captain Lee Dunbar and his unit work day and night in a never-ending battle against the opioid epidemic sweeping Maryland and the country.
We're here in the city, miles away from Hartford County. Why here?
what happens here that affects you?
Well, what happens here, this is where the vast majority of our heroin and fentanyl is coming from. The majority of our citizens that are suffering from this opioid addiction are coming down here to the city on a daily basis.
WJZ gets rare excess spending 2 nights with the task force. In addition to the bust in Baltimore City, our cameras capture one along I-95 in Harford County. Traffic stops like this are the backbone of major investigations into the ever-growing problem of opioids on our streets. In this case, a vehicle goes into Baltimore City. A deal is apparently made, and drugs are brought back here to the streets of Harford County.
In plain view, this is a packet with gel caps.
This is death right here. This kills someone.
And depending on the user, maybe even partial of one of those capsules could kill them.
For many of these officers, this is a personal mission. Almost everyone on the task force has been touched by the opioid epidemic.
My family has not been immune from it either. We have guys where it's hitting very, very close to home in our agency, and it becomes personal for us because we're responding out to every one of these overdoses.
These officers are gaining international attention for their aggressive, innovative approach.
We want to send a message up in Harford County. You're dealing drugs to our citizens. You're killing our citizens with the drugs you're putting in their hands down here. We will come down here and lock you up and prosecute it to the full extent of the law.
Sheriff Gaylor, these are your guys out there every day. We had, of course, pleasure of going out with them and having them show us exactly what they're dealing with on a day-to-day basis. Were you prepared for this?
I don't know if prepared is the right word. We certainly knew coming into office a couple of years ago that we had to deal with this, and we had to deal with it head on. We haven't tried to hide from it at all, but one of the tactical approaches from the law enforcement stand that we took was certainly different in that we began sending out a drug investigator. One of Captain Dunbar's people, we have a task force up in our county that's a conglomeration of not only sheriff's office, but our municipal, state, and federal partners. We began sending a drug investigator out on every scene so we could figure out who was selling and who was responsible for taking so many lives. And because of the task force concept, our partnership with our state and federal partners, it allows us to chase those dealers wherever they think they're going to hide and bring them to justice. And I couldn't say enough good about the task force and the work that men and women do there.
Now, we've seen that this is a model for programs, and people around the country and around the world are looking at the way you're doing things. Tell us about that. Where have people been sharing some interest in your program?
Oh, it's from across the state, from across the country, and yes, indeed worldwide. We've done pieces in Captain Dunbar from France and from England. Again, holding people accountable. And there's two perspectives to it that some individuals use to support their habit, and then there's those that we know that they have dealt with that are in it purely profit-driven. And those are the ones that we really want to target, and we want to put in front of the judicial system to ensure that they are seeing maximum time and maximum sentences for the lives that they are responsible for taking out of no more than greed. You know, so they do a great job. And again, their efforts are being looked at and modeled around the country and worldwide, because this is a worldwide epidemic.
Okay. Denise?
Yes, Vic. Knows no boundaries, knows no demographic. I am with Captain Dunbar, who you just saw in that piece that Vic did. And you talk about it being very personal, so I can imagine that gives you an extra drive to get out there every night. But what about what Dr. Wen said, that this is a medical crisis? How would you respond to that?
Sure, it absolutely is a medical crisis. Like the sheriff said, we team up with our local health department there on a national level with Hardie as well. When we respond out to these overdoses, our main function is the enforcement to target the dealer, not the individual that's suffering from addiction. Each one of my detectives have a help card. We provide them a help card first so they can get help with their addiction, but we also need to find out who those dealers are, track that back to those drug trafficking organizations, which unfortunately is coming back to Baltimore City. About 70% of our fatalities and overdoses in general are coming back to the streets of Baltimore, and that's our objective, is to target the dealers, target the drug trafficking organization, get them off the street, charge them to the fullest extent of the law. We're treating them as crime scenes, especially our fatalities, such as a murder. We're going to our federal prosecutors, our state prosecutors, Mr. Castley, his deputy state's attorney, Dave Ryden, who's prosecuted some of these cases for us, and charging individuals, indicting them on second-degree murder and manslaughter charges. These are the actual dealers. These are the people out there making millions of dollars out there in the streets. So we're not targeting the addict. We're trying to get them help, but at the same time getting valuable intelligence so we can target the drug trafficking organizations.
All right. Thank you for what is obviously very good work that you're doing.
Absolutely.
Thank you, Dick.
Thank you, Denise. Organization Organizations across the city are trying to shoulder some of the responsibility to stop this epidemic. Joy Burnett has the stories of two men in two separate stages of drug addiction and how a nonprofit called the Baltimore Station is trying to help.
The effects of Baltimore's drug epidemic are present at all hours. A visual cue could trigger a relapse. That's what happened to Michael Rosenthal.
I bought some drugs from someone, which I thought was supposed to be heroin anyway. But come to find out, when I woke up in the ICU at Johns Hopkins, come to find out there was fentanyl in my system.
He woke up a different man.
The muscles died because the circulation was cut off. They tried to save my leg at first, but it was beyond saving, so they had to amputate.
Each year, the Baltimore Station provides housing and drug addiction counseling for hundreds of men like Rosenthal. And there's one man who's going out onto the streets in search for addicts.
It's just unfortunate.
James Hardie's personal story prepared him for this role.
I started using marijuana back in '72. And it manifested, you know, from marijuana to drinking to pills.
In less than 40 minutes, James spots a man who says he's currently hooked on synthetic marijuana, a chemically altered substance that could lead to death.
Can I pull over and talk to you?
James' task is now to rescue the 28-year-old before his drug addiction leads him down the same path.
How often are you using?
Every day.
What's your worst fear?
Dying. I don't want my mother burying me or my sister burying me. We're going to do something about it to help you. All right? Yes, sir. Thank you. You got my word on that. All right.
A young man's desire for change may save his life.
Is this kind of a last resort for a lot of people? It is, yeah. And so when men come to our program, they've usually hit rock bottom. And like I said, they've really burned a lot of their bridges, but do realize that they want to get into a program that is going to get them the help that they need.
Well, I'm standing here with James Hardie, who, as you heard, is in recovery and has been doing this phenomenal work for 28 years. Is this the worst it's ever been right now?
Yes, it has. Been very bad. When I first started using it, wasn't this bad. Now more people are dying, and there's not a whole lot of help for them.
So what is the key to getting someone to agree to treatment? How do you talk them into getting to that place?
First of all, I get them to trust me. You know, and I let them know my story, that there is help out there for an individual. And once I gain that trust, I do the work that I need to do to get them in. And I just keep calling them. I keep reaching out to them until they decide they want to give in and try to help themselves.
You know, we hear a lot that it's really hard to kick these opiates, that it's tough, that people go to rehab multiple times.
Yes, they do, but you can win. You can't stop. You just got to keep going and going. You know, there's plenty of programs around that can help you, but if you don't have the will and the drive, then you ain't going to get the work, and then nobody's going to help you.
Thank you, James, for the work you do. Thank you. Dick.
Thank you. Mr. Wiggins, you deal with this every day. Tell us more.
Well, we deal with it every day. We have a full range of behavioral health crisis services that include addictions treatment. But I think what's important, and was an excellent example by the last speaker, is the importance of peers in recovery. One of the things that we've added to our staff are peer support specialists. The thing about peers is that they demonstrate through their daily process of living that recovery is a process. You're not going to go in and get cured and everything's going to be hunky-dory. You're going to be in recovery for the rest of your life, and that's what peers demonstrate. We have one peer with our LEAD program who single-handedly has rescued 6 people, okay, with naloxone, who he just saw passing out on the street. I mean, think about that. And he came in and said, you know what I did today? And I'm like, no, I rescued somebody. And I mean, it's that level of commitment, I think, and that's what's important.
All right, thank you. Denise?
Well, I'm here with Pastor Derek DeWitt from the First Mount Calvary Baptist Church, and I've heard Narcan has a street name of Jesus Juice, and I understand that your church that you are training your parishioners on how to hand out Narcan. Is that right?
Yes, we're training the parishioners and other churches as well. We're inviting other pastors to come in and to learn, because we're seeing this every day, and sometimes even on Sunday when we walk out of church, we encounter people who have overdosed. And with the other programs that we're running, soup kitchens and food programs, we have people who come in, and unfortunately we witness and see this every day. So we thought it prudent to be able to help and to revive some of these people, because as Dr. Wynn said, the first thing is to save the life. And then we know that we have faith-based institutions that have programs that have succeeded, drug rehab programs that have succeeded, and we try to get the word out so that we can collaborate with federal and local agencies and the foundations to be able to duplicate our efforts and save more lives and get more people in and out of treatment.
Saving lives. Well, Narcan is important for that. So are fentanyl strips that allow users to test the heroin before they inject it. And there is one mother from Carroll County who knows that firsthand and uses those tools. And she knows that treatment doesn't always work. Her son went to rehab 7 times in 5 years before he overdosed and died.
I remember just hearing the screaming, and I couldn't, at first I couldn't focus on who it was, and then I heard it was me.
This is the last photo Gina DiMaria has of her son, taken 3 weeks before he died of an overdose at 22. Anthony was a good kid, a state champion motocross rider, but when he broke his femur in an accident, doctors prescribed OxyContin and Percocet for the pain.
So things
he became addicted.
Back then is nobody should have pain. Nobody should have pain, especially kids.
Needing to feed his addiction, he later told his mother opioid pills were too expensive.
Someone had introduced him then to a $10 baggie, and it did the exact same thing.
His last rehab 5 years ago was going well, and then
I believe he met up with some people, and they had heroin, and he used that one last time. It takes everything from you, and then it takes your life.
I would imagine that the hardest thing is wondering what your son might have become.
And I miss him terribly.
Gina has turned her heartbreak into action, working up to 90 hours a week to save the lives of other addicts. She hands out Narcan and test strips for deadly fentanyl.
Right now, it is so out of control that we've got to try to keep them alive.
It's that basic.
It's that basic. We've got to keep them alive, because if we keep them alive, there's a hope for recovery. If they're dead, there's no hope for recovery.
And Gina's story I have heard again and again of somebody who is taking the pain pills for a legitimate reason. They have an injury, they have a surgery, and then before they know it, they're hooked.
Yes.
And that's what happened with your son.
Yes, it is. He became injured, he broke his femur, and at that time the mindset was no pain. They didn't want any, he was only 15 years old at the time, and they didn't want him to have any pain.
And tell us what you do now with Anthony's Way.
With Anthony's Way, I do a lot we do outreach on the street. We have tried to change our way of approaching people because of the ever-changing drug, fentanyl. There's been a time where I noticed that there were a lot of people not calling us because of, trying to get into detox, and we started I started talking and asking people, and the reason is they're dying. The heroin a year ago isn't the heroin today. One-time use, they can die. So we try to give out, we've given out an enormous amount of strips. They're expensive, but we tried to give as many as we can out, and it's not going to stop them from using, but it's going to keep them alive.
And your son did go to rehab. He tried.
He tried. He went to rehab 7 times. And it was just, it doesn't make sense. I mean, that's why I believe wholeheartedly it's a disease, because of the constant drug seeking. And that's what he did. He constantly was drug seeking.
Well, you've made it a mission Yeah.
Thank you.
Yeah. Right. Thank you, Gina.
Well, certainly this is a story, and all of these stories resonate with you, Pastor McLaughlin. Tell us a little bit more about your circumstance with your daughter.
Completely shocking. If you knew my daughter a week before she went into middle school, and then you knew her 2 months later, you would think this was two different people. Mm-hmm. There was an explosion. Like I said earlier, there was kind of a raging sea under that calm surface. But I think maybe the hormones of adolescence and middle school kind of released that storm. And just, you know, one thing I tell parents is all your critical decisions you've got to make right at the start. Once they get very far down the road, the impact of decisions you make has less and less power. And yet that's when you don't know anything. You're not educated, you're not equipped. So that's what it felt like. She just started moving faster and faster. It was 1,000 miles an hour very quick.
How long did you live with this issue? How long was the process?
She started smoking marijuana, drinking age 12, kind of hiding that from us. We didn't really know it at first. She took a pill at age 14, age 15, right in between there. It was 0 to 1,000 miles an hour right at that time and took off. She died when she was 19, almost 20. She was in 21 different institutions, between rehabs, detoxes, psychiatric units, juvenile detention.
This is only over a 6-year period, 5 or 6 year period, right?
Right.
Okay.
Amazing.
Had to test your faith.
Yeah, exactly. You know, something they say, parents, you didn't create it, you can't control it, you can't cure it. And then you wonder about God. Where's God in all this? And what I would say is God is right there with you. And God is right there with your loved one who's struggling. He never leaves them.
All right. Thank you so much. Well, we're going to turn now to Denise in the audience with another interview.
Thank you, Vic. I'm with Dr. Gregory Branch, who is the health director of Baltimore County. We've heard about Anne Arundel County. We've heard about Harford County. So what are you seeing in your county, and what are you doing to fight it?
Unfortunately, we're seeing the same thing. So many lives lost. And so we have a philosophy in Baltimore County that we have to meet people where they are. We ask our peer recovery specialists to go out on the street, go check them out. It's our reach team. They're there for caring, connecting, communicating with the people so that we can make a difference in their lives. It's also very important to educate everyone about Narcan. I believe in second chances, third chances, fourth chances, how many chances they need. That's extraordinarily important. One of the other things that we focus on in Baltimore County is educating our providers. We have a PDR, prescribing drugs responsibly, and we try to teach our providers what's the best way to do that so a lot of this does not start. I can tell everyone, if you have any questions or any concerns and you're in Baltimore County, call us, 410-88-REACH.
Where would you like to see Narcan? There are people calling for it to be in the schools.
We have it in the middle schools and in the high schools. Very, very important. We have nurses in all of our schools. We know that we even had a 9th grader who overdosed in our school.
Yikes.
However, we were able to save that life because we had Narcan in the school. That was another chance. This is real, and it's a matter of life and death.
Boy. Vic.
Incredible stories. Well, as the opioid-related deaths skyrocket across the country, police and public health officials are now fighting the epidemic from their cell phones. An app which was developed right here in Maryland is helping to predict waves of overdoses in real time. Kimberly Eaton has a story now of how this technology is tracking thousands of opioid cases.
Clusters of colorful markers pinpoint 24,000 near misses. And in the worst cases, deadly doses of opioids as the waves of drugs cross state lines and crash down with fatal force.
Folks can get sort of an early warning alert to say, hey, they've had a spike last night. We could be next.
Developed by the High Intensity Drug Trafficking Areas Program, Deputy Director Jeff Beeson says ODMAP is the first app to follow the flow of opioids across city and state boundaries. days, down to the minute, down to the street corner, and in real time. Tracking the opioid epidemic like scientists would track the spread of an infectious disease.
We can see the same thing with overdoses. We look down at patient 0, the first overdose in a 24-hour period, and then we can see the overdoses move as the drugs traffic throughout an area.
In Maryland, that starting point is often Baltimore City.
There are areas across the country that we know are sources of supply. Baltimore City is a source of supply for our region.
Pumping out a dangerous supply of heroin, fentanyl to surrounding counties and neighboring states. Well, law enforcement fights the new war on drugs.
Put your hands up there!
Now, with this technological tool in their arsenal.
Law enforcement can now pinpoint areas of need. They can put undercover cops in those areas. They can build cases to take down the people selling poison, the drug dealers.
A high-speed and high-stakes challenge more so than ever before. In the first 9 months of 2017, opioids killed 1,500 Marylanders. More than 500 of those deaths on the streets of Baltimore.
Drug distribution knows no bounds. Drug use knows no bounds.
With an ever-rising body count, Beeson says more agencies nationwide are signing into OD MAP to stay one step ahead.
We all have limited resources, limited time, limited money, people power. So we want to be able to focus those efforts where the need is greatest in real time.
Well, we're so grateful to have Jeff Beesman and Tom Carr from Hardie with us. Thank you so much for being here. But right now we're also happy to have Attorney General Brian Frosh here, which is really important because what we have not talked about yet is the responsibility of the pharmaceutical companies, the role of the manufacture of these drugs and the distribution of these drugs. And I know you have joined with 41 other states in trying to do something about that.
That's right, Denise. We are in an investigation with most of the other attorneys general in the United States about the conduct of these manufacturers. We've seen a flood of opiate and opioid medications pouring into our state and all over the country. And we've also seen marketing practices that are unheard of in the industry.
Such as what?
Well, they hire speakers that go out and doctors that presumably go out and speak to other physicians, but in fact are getting paid, and their prescriptions skyrocket after they start getting paid by the manufacturer. And there are many other marketing practices, suspicious activities, and grotesque oversupply that have plagued our country, killed many people, and addicted many, many more.
And fentanyl is coming from China, is that correct?
Fentanyl is coming from China. Some of it's manufactured here as well.
What about creating guidelines by how much drugs should be prescribed for a different kind of pain level?
Well, I think you're seeing a major change. We've been through 2 shifts in medical theory in the past 20 years. Starting in the 1990s, the doctrine was that we don't want to see anybody in pain. I think that was more of a marketing effort on behalf of the pharmaceuticals than it was a legitimate medical issue. I don't mean to diminish anybody's pain, and nobody should have to suffer, but it resulted in overprescription of opioid medications and chain reaction in terms of heroin addiction after people couldn't afford the opiates.
As we have seen, as we've been seeing over the past hour. Thank you. Thank you, Mr. Frosh. What is a parent to do if you suspect that your child might be involved in drugs? Well, Harford County has created a really eye-opening experience for parents. It's called Hope House, and it will give you a lesson very quickly. From the outside, it's just a trailer. Inside, a teenager's room. Not much to see until you learn how to look.
This is where the marijuana was found, in the light, in the closet. But you're also going to look at the toilet paper dispenser, because that's where the syringes were hidden.
Really? Hope House is loaded with simulated drugs and paraphernalia hidden in places you'd never suspect, unless you're a police officer who's seen illegal drugs hidden in every one of the spots featured on the tour.
Young girls carry their tampons. In this case, they have their syringe in there.
Hope House has educational materials and photos of real victims who took prescribed opioids for an injury, transitioned to heroin, and died of an overdose. A tape is played featuring devastated families.
Now we're living a nightmare.
The hope is that when a parent leaves here, they'll go right home and search their own child's bedroom. And that's exactly what Donna Mandel, mother of a 15 and 17-year-old, did after her tour.
Just completely shocked me, the level that people will go to hide their drugs.
This is another clue that things are becoming more dangerous.
Whoa.
Small, innocuous things that you may not think twice about after you take the tour. I think, it's going to set a light bulb off on your next time through your young person's bedroom.
And the message is you should search.
It's not a matter of trust, it's a matter of keeping them safe.
Pastor McLaughlin, if I can ask you about your daughter, and I'm so sorry what happened to her, but did you search her room? Would you tell all parents, whether you suspect your child or not, just to go in there and make sure you know and look, is it that bad? Are we at that point?
Yes, over the top. That's what I tell parents. Go over the top. Search the rooms. Once they're down the road, just a block down the road, they're gone. It's almost impossible to get them back, so be on top of it. I tell parents, it's your house, be on top of it. Search the rooms, know all this. I tell parents all the time, look for this, look for that, and they're stunned. That's what needs to get out to parents and grandparents.
Even though your teenager is going to say, don't you trust me?
Exactly. Exactly. They know that you love them already. So be over the top.
Good advice. Thank you, Pastor.
Thank you both. Well, one nonprofit that's serving as a resource for parents searching for help is the Partnership for Drug-Free Kids. Now, this public service announcement shows the work they're doing to help families who are battling addiction.
I went from using Percocets to heroin.
Both my boys started using. We started finding bottles of pills.
She was mad, we were mad. All communication had broken down. When you have a child using substances, you have so many people offering opinions.
The cookie cutter, one size fits all advice to detach from our kids.
I was being told about tough love,
rock bottom.
The belief is that somebody using substances, the only way they're going to change is if they have a massive pileup of negative consequences.
And I'm standing here with Steve Klein, who's with the Partnership for Drug-Free Kids, and also with Susan Nagel, who the last image that we saw there was your daughter, correct?
Yes, yes. And I'm really happy to say that today my daughter's doing well. She's been in recovery for about 3 years, on and off. It hasn't been easy or simple. She's been through a lot of different treatments. She's been to treatment 7 times. She's been on medication-assisted treatment. If you could see her today, she's absolutely gorgeous and beautiful, and she's thriving. But parents really have a big role to play in this, and the family component is huge. And people just don't realize that how important the family piece is. The family needs to be in recovery also. And the Partnership for Drug-Free Kids offers support for families. We have a helpline, 1-855-DRUG-FREE, that parents can connect with a parent coach who will help them learn some strategies that make it possible to motivate and influence their children. We don't have to wait for our kids to hit rock bottom. We can raise the bottom for them by being there for them, learning strategies like asking open-ended questions, really understanding why they're using substances to begin with.
And in the PSA, it says something like, everybody says take the hard line, implying that the hard line isn't always the best way to go?
Not necessarily. I think it's been mentioned up here, the idea of communication, and communication starts as early as your son or daughter can understand you. It's also leading by example. If you're saying don't do this and you send a 5-year-old to the refrigerator to grab you a beer, what kind of message are you sending? I think it's very important, the education of responsible adults, and that's another area where we come in. Our website is a trove of information regardless of where you are in your own personal situation.
Partnership for Drug-Free Kids. Thank you. Thank you both.
Thank you.
Vic?
Thank you. In April 1988, Baltimore Mayor Kurt Schmoke said something that would shake up law enforcement and the medical community, at great risk to his own political career. He boldly suggested that drug use be decriminalized and instead treated as a health concern. Mayors and law enforcement across the country disagreed with him and presumed he meant the legalization of drugs. Well, not so. And here we are, 30 years later, and Mayor Smoke's idea is becoming a reality. But it was not an easy task.
What I was trying to do then was to explain from my experience having been a prosecutor and then having looked at the drug problem as a mayor, that this was primarily a public health problem. And that's all I was trying to do, was to get people to understand that we needed a war on drugs, but it needed to be led by the Surgeon General, not the Attorney General. It should be a public health war primarily, rather than a criminal justice war.
When you look at the problem today, what comes to mind?
One of the reasons that elected officials now are comfortable talking about it, it's because everyone sees the problem affecting all walks of life. It is not limited to the poor people in the inner city. It is all over.
Many people have made the argument, though, that just as you pointed out, when this was limited to an inner city problem, that was an okay concept. Lock them up.
There was there was resistance. Folks viewed drug addicts or people addicted to drugs as them, not us. Now there's a sense that it's all of us.
Is it frustrating to you that it got to that point, that the problem had to expand into the suburbs and to teenagers who look like good kids, so to speak? And
well, I think what's most disappointing is that so many families had their lives disrupted in the late 80s and 90s by people going away to prison rather than having treatment and health care intervention, because those guys, men and women, going into prison, when they came out, they could hardly get in any employment because they had a prison record.
Dr. Wynn, of course, you and Kurt Smoke saying the exact same thing these days.
There's been a sea change in attitude. We now recognize that addiction is a disease, that there are things that work. But what I'm very concerned about is the fact that we know what works. We just don't have the resources to help us to get there. Naloxone, for example, everyone's saying it saves lives. We know people whose lives have been saved, family members, community members who have their lives back. But here in Baltimore City and across the country, we are having to ration. We have to decide every day about who has access to this medication and who has to go without. I mean, treatment, only 1 in 10 people with the disease of addiction can have treatment, which we would never accept for any other illness. In the time that we're having this town hall, 5 people across the country will die. I mean, what kind of message are we sending to our children and to generations yet to come, that we know the problem, we know the solution, we know what works, but where is our willpower to get there?
So where do you think the money should go? If money was available, where would you put it first?
I would put first to saving lives, because if somebody is dead right now, there's no chance for them to get into treatment tomorrow. Second, I would increase access to treatment, because we talked about the supply issue, reducing the supply of drugs. But if there are millions of people who need treatment, that demand for drugs will continue to fuel supply. And then I would put money into reducing stigma, preventing addiction in the first place.
Okay, thank you. Denise.
Well, thank you, Vic. I'm with Zach Stinser, who's with the Maryland Addiction Recovery Center, one of those people who has dedicated himself to helping those who are fighting the disease of addiction. So we've heard people talk about recovery. I mean, Dr. Wynn says we saved their life, they're alive, they decide, Mr. Hardie finds them, he gets them, convinces them to come to treatment. How do you get someone to long-term recovery?
So I think, you know, there's a couple things to be said for treatment, because we've heard that a lot today. Addiction is a chronic progressive illness, right? Cancer, heart disease, diabetes. Of those 4 things, addiction is the most treatable, and yet is sought the less, right? And part of that is the stigma, and part of that is the, I guess, the societal view of what treatment is, right? So as a chronic progressive illness, treatment requires long-term care, right? We've seen major success in treatment programs that are dealing with pilots, with medical professionals that are 5 years and longer with high success rates. as a society, we have to deal with the stigma, and we also have to understand what treatment should look like. The idea of a 5 to 7 day detox, medical stabilization is not treatment, right? A 30-day stay, which is the typical understanding of what treatment should look like, while very important in the continuum of care, is just one step in what treatment should look like. Treatment needs to be a long-term process. You also need to deal with patients that are lacking life skills, that don't have higher education, that don't have job training. We need to work in a full continuum to get them back to a place where they have the support of clinical services and are getting the necessary needs met, so when they're done treatment, they're already living productive lives. That's, as a society, what we need to get to. When we think of treatment, it cannot be 7 days and going home, or 30 days and that's it. It needs to be a long-term continuum with comprehensive clinical services.
All right. Very interesting. Thank you so much. Thank you, Zach.
Thank you, Denise. Reducing overdoses by creating safe spaces for people to take drugs. It's an initiative under consideration in Maryland and in other states and around the world. Political reporter Pat Warren has more on shifting the approach to addiction, from crime to public health.
Parents across Maryland share the fear.
It's a living hell. You worry day and night.
Worrying about her son addicted to heroin, she finds comfort in the hope her son is in a safe consumption space where users are monitored.
At least there, I know that people are watching over him, and if he does overdose, he's not going to die.
I will say that of the millions and millions of injections for the past 30 years that have occurred in safe consumption spaces around the world, there's never been one fatal overdose.
This is Insight in Vancouver, Canada, where addicts can do drugs without being arrested and with monitoring to prevent fatal overdoses. It's something Dr. Susan Sherman of the Johns Hopkins Bloomberg School of Public Health is asking Maryland lawmakers to consider.
It's a hard pill to swallow, so to speak, for people, although there's cities like San Francisco, Seattle, New York, Philadelphia, Albany, Denver that are considering and much further along than we are legislatively.
For Baltimore, not only legislators, but users too need to be convinced.
So there's really a lack of trust and of that things like this will actually benefit people, that you could actually go into a space and you're not going to be arrested.
Cities in 12 countries around the world have safe spaces.
All right, I'm standing here with Ricky Morris, who is in recovery. He's with Be More Power. Thank you, Ricky. And Regine Goodla-Valenti.
Yeah.
Oh, thank goodness. Who also is here with Safe Spaces. And one of the lines that struck me in that story is there has never been a death by overdose in a safe space.
Correct. There's over 100 of these spaces, these safer drug consumption spaces around the world in over 66 cities. And millions of people have injected drugs, have used drugs in these spaces under supervision of medically trained staff and peers. No one has died of an overdose. These have existed for decades, and it's about time the United States has them.
Why do you think, Ricky, that the people are so nervous about having them?
I don't understand. It's like they're scared of accepting it, because I lost my only sibling because he was hiding away in an abandonment getting high. And if he had a space like this, maybe his life could have been saved. And then when people are ready to come around the treatment, there are resources right there to guide them in the right direction. It's a win-win situation.
A lot of people may say yes, but aren't you encouraging them to take drugs by giving them a space where they can do it safely?
The fact of the matter is that people are using. They're using in alleys. They're using in unsafe ways with used syringes, without anybody around to prevent the overdose. And we have naloxone, which is an exciting harm reduction tool. But if there's no one there to administer that naloxone, the person's life will be lost. We have these really dangerous drugs out there on the street that we've been talking about today. People are at higher risk of dying. There needs to be spaces like this that are compassionately centered.
It's about saving lives. That's what it's come down to. It's about saving lives, and it stops the spread of HIV and hepatitis C.
Absolutely. Thank you. Interesting idea of a safe space. You can be there. We are about at the end of our hour, and I thought it's been extraordinary. We've talked about safe spaces. We've talked about making pharmaceutical companies responsible for the way that drugs are distributed. We've talked about law enforcement finding those dealers and locking them up and giving them tough charges. A lot has come out of this. Maybe we start with Narcan everywhere. Rick.
Okay. Denise, thank you very much. Of course, we want to again thank everyone for joining joining us here today for this town hall. As a reminder, you can also let your voice be heard by taking part in the Be Heard Baltimore surveys. You can find the link on the Baltimore Standing Together page at WJZ.com or by going to the Be Heard Baltimore ubalt.edu. We look forward to continuing this conversation, and we'll hold an additional town hall later this year addressing city schools. On behalf of WJZ-TV, the Baltimore Sun, and the University of Baltimore Schaefer School of Public Policy, thank you so much for joining us, and let's keep talking.
Watching a WJZ special, Baltimore Standing Together, searching for solutions to the opioid epidemic, presented by Healthcare Access Maryland.